My questions to the Premier. As families across the province line up 5, 6, even 8 hours with thousands of potentially sick people to get their tests, the Premier declared that he was perfectly okay with a new private company that plans to offer people testing at home for a price. The Premier says it's a free market society. Speaker, through you to the Premier, we know the Conservatives wish that we had an American-style two-tier healthcare system, just as the Minister of Long-Term Care. But does the Premier really think that families should have to pay $400 for this government's failure to plan?
The Government House Leader.
Thank you very much, Mr. Speaker, for the question. I'll remind the honourable member that it was actually a progressive Conservative government that brought in socialised medicine here in the province of Ontario, Mr. Speaker, and we're very proud of that. Since coming to office, we've made historic investments in health and long-term care. Many of the problems that we inherited from the previous 15 years of the Liberal NDP coalition in this place, we have started to address, whether that's providing additional resources for long-term care homes. When it comes to COVID-19, we have spared no expense in preparing the province of Ontario, and that includes testing. Mr. Speaker. Across every region of this province, we have increased the capacity for testing, and we are going to continue to do so in our fall preparedness plan, Mr. Speaker. I'm very proud of the people who work in healthcare across this province. They have done a spectacular job in making sure that Ontario is amongst the safest jurisdictions in North America in which to live, work, and to raise a family, and I'm proud of that record.
And the supplementary question.
Mr. Speaker, the last time I asked a testing question in this House was 6 months ago. What has this government learned? The Premier's plan does not do enough to prioritize the needs of families across the province. In Waterloo Region, lineups for testing have gotten so bad that the police were called. I heard from a student who has taken transit to the testing centre 4 days in a row, and still they have not been able to get tested. And this morning, the testing facility in KW was full for the day at 7:15 a.m. People arrived at 3 o'clock in the morning. People can't afford to spend hundreds of dollars and sometimes days waiting for a COVID-19 test. Speaker, does the Premier expect everyday Ontarians to shell out hundreds of extra dollars for a private COVID test when they can barely afford to take the day off in the first place?
Government House Leader.
Mr. Speaker, again, I'm not sure where the member has been. The Premier outlined yesterday, as did the Minister of Health, the significant investments that we are making in testing across every region in this province.
Order.
We're massively increasing testing capacity because we know how important it is not only to ensure that people have the confidence that they are safe in their community.
The official opposition come to order.
It is that our educators feel safe, that our students feel safe, that our economy continues to be working, and it is because of that why we've made such investments in testing. We have tested more than any other province combined. Ontario's doing more tests than all other provinces combined. I think that is something that we should be proud of. Does more have to be done? Absolutely. If the one thing that we are learning through this COVID crisis is that you can never let up, that you always have to be prepared and expect the worst, and that's what this government has been doing since day one, sparing no expense in making sure that Ontario remains the best place in which to live, work, invest, and raise a family, and ultimately we'll make sure that the people of the province of Ontario are safe, because that's our obligation.